So the comprehensive ophthalmic app and with augmented reality. Can I timer face me? Okay, fine. Can I start, sir? Yeah. So this is a neuro-ophthalmic app that we devised. So there were a lot of theoretical limitations, especially when it comes to neuro-ophthalmology and structures relating to non-dissectable structures like the cavernous sinus, the circle of Willis, or the complex neuroanatomical structures. So keeping that in mind, we wanted to also devise a digital application called the IMG Max, where we use 3D animated ophthalmic images, more of unanimated images. We built a 3D interface with real-time confocal images for learning as well as for e-counseling. So this is subtractive learning, virtual dissection, and augmented reality. So you can see the buttons here given in this app. The user will have the freedom of choice to remove the skin or choose the skull. With the fingers, the dissection can be done, which is not possible or never been done, at least the neuro-ophthalmic complex structures in the curriculum. So the meninges are now being removed, and then you can see the brain stems can be selected, or the brain. So the structures that the user or the pedagogue does not want to really see, or reduce it in transparency to really study where is the anatomical correlation between one structure to the other, which the textbooks does not offer, because of you can't subtract something in a textbook or in a printed format, right? So we just start with the anatomy, get it done in a three-dimensional way, read the Cunningham's Chaurasia and got it in a three-dimensional way done. And you can see this is subtractive learning. Also, you can do the virtual dissection in the eyes also is possible, as well as the different nerves, the cranial nerve pathways, each with each, or you can also have different nerves separately. So this is not only done in a two-dimensional interface or a three-dimensional interface. We went one step ahead in the smartphone, where you can have the LiDAR technology. This is launched today. If you type IMG Max in your App Store, it is there, where you can see this as a hologram appearing in your mobile phone. You can walk out with this Wikipedia or this neuro-ophthalmic gadget in your pocket today. You can see that now with the fingers you can rotate it, you can move through it, navigate it, and this is going to be where the anatomical relationships, which are very difficult to comprehend, this is something that we wanted to crack, so that it helps in learning as well as even for counseling for that matter. This is the template that you can see. Even a simple fundus simulator is possible. You can see here, once the models are loaded, if I'm going to take my phone into the pupil, the phone mimics like a direct ophthalmoscope. These are simple neuro-ophthalmic things that we need to teach a general physician or even a neophyte postgraduate or an undergraduate, or for that matter any medical person. So this is very, very important, because it reduces the learning curve is what we believed in, because there are a lot of theory in which we tend to talk, but can we reduce the learning curve and increase the shift of speed in making, and even the trochlea or the any structure for that matter in 3 dimensions, and even e-counseling. So what we went ahead and did with this was we also validated it as to how practical it really looks, to see the level of satisfaction with the classes for neophytes with this and without this. So the cross-sectional study, a comparative one on a Google platform. The app downloads were done, and the physicians or the first year postgraduates were included, and these were the components of the questionnaire pertaining to knowledge, tutorials, innovative representation, and 217 invitations were sent to the downloads. And we also got 203 respondents who responded about the utility of this particular application that they felt when compared to a textbook. Of course, discrete variables of the satisfaction levels were converted into continuous variables. A pair t-test was done, and the p-value was significant with the 0.05. And it's not that with this app they felt much better. You can see 97.4%, the satisfaction levels were much good. Even with textbooks they were okay, but they definitely felt a 3D dictionary, which is much more subtractive to navigate with the fingers. It was much better is what the feedback that we got, and currently we are working on adding more and more structures. So this serves as a pedagogical transformation, e-counseling stations. Even for ophthalmology, it can really work out for simple injections to complex surgeries, even moving into glaucoma or retina surgery, it can really work out. But I feel the main thing is neuro-ophthalmology, because of the three-dimensional complexity that neuro-ophthalmology brings on the plate. So this is a QR code, my dear friends. You scan this in your iPhone, because you need to have LiDAR technology, and this app can be downloaded today. It uses real high-resolution confocal fundus images. It simplifies the neuro-ophthalmic concept learning for an immersive 3D pedagogy. And scan this and you get this to use it. And this is one of the photoreal, visual and augmented reality cutting edge, where we can use it for neuro-ophthalmic learning. Thank you. Ma'am, this paper was actually presented in MTC and it won, and they wanted me to present it again because there was no best of best session there. To validate it once again, the scientific committee wanted me to present.
Any questions from the judges?
You said you looked at the knowledge in those who used it versus who didn't use it. So what was your conclusion, or what did you arrive at?
Ma'am,
when you looked at the questionnaire form and you converted it into a continuous variable, what was the result of it?
Ma'am, the knowledge part of it, it was mainly the anatomical relationship structures, how each structure was related to another structure. When the textbooks were used, there is only a single particular frame. We used the questionnaire where the frame of choice. There, the frame of choice is what the author wants you to see. But here with this app, since there is a hologram, you can navigate any way you want to, and the frame of choice is given to the user.
Absolutely understandable.
Yes,
the only thing I wanted to know was, because you said there is a questionnaire sent and there is a comparison study done, what was the knowledge in those who used it versus
Ma'am, it was only the frame of choice. The frame was only thing that we put it in. We didn't have a complex one.
She's talking about the questionnaire. So what you have presented is what they were understood.
Yes, sir.
But when you said that you did a study in that 203 people who responded, so what was the study all about? What was the questionnaire and what was the response?
Sir, in the questionnaire, in the questionnaire it was more on comprehension. That is how quickly they were able to understand a concept better, and how applicative it was compared to it was more of a cognitive one on a grade of 1, 2, 3, 4. How quickly they were able to understand the concept of anatomy better, how quickly they were able to understand the concept of the relationships of the structures better.
So basically you asked them a question and it was a subjective answer that we understood or we didn't understand. You didn't test whether they understood, whether they liked it or didn't like it.
Correct, sir. It was a very basic one because we didn't know who were the downloads. We did try to contact them, so we wanted to have it very basic. Yeah.